staff, management, or sponsors.
Trilogy was established in 2016 by industry experts with over 30 years in home health care operations spanning 30-plus counties throughout the state of Florida. With offices in Jacksonville, Port St. Lucie, West Palm Beach, we strive to provide the most optimal care to our patients in a fun, forward-thinking environment. Our focus is on personal relationships, whether with an employee, a patient, or an outside community. Because we know that when people enjoy what they do, it becomes why they do it. Call Trilogy today at 954-689-6660 and ask for more information. In addition to offering the standard mix of services, SN, PT, OT, speech, MSW, and HHA, we also take great pride in being on the cutting edge and offering care and education to our licensed clinicians in other areas most agencies likely don't offer. Emotional and behavioral health with our psych nursing, biofeedback for bladder incontinence and pelvic pain, chemotherapy, IV hydration, antibiotic and respiratory therapy. Call today at 954-689-6660. Trilogy Home Care.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to your Hometown Health Show, brought to you by Trilogy Home Healthcare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
Good evening and welcome. You are listening to your Hometown Health Show. I am Yolanda Santana, your host for the evening, and I'm with All Bits Tech. This show is sponsored by Trilogy Home Healthcare, and tonight as our special guests, we have Claudia Porta and Edwin Charles from the Plaza of Hallandale Beach. Welcome and good evening.
Good evening. Thank you.
Thank you for having us.
We also have Tony Brown from Trilogy Home Healthcare. Good evening and welcome.
Thanks, Yolanda. It's great to be here again.
Well, it is fantastic to have you. Fantastic to have you all. For those viewers or listeners, we are live on 95.3 FM, 104.3 FM, as well as 103.9 FM and 1470 AM, as well as AMP2 TV Live. So, welcome again. Please tell us a little bit about yourselves and a little bit about your company.
So I'm Claudia Porta. I'm the Executive Director at Plaza. I've been in healthcare now for about 5-6 years. No, I'm more actually. 5 years in the nursing home and almost 3 years at Plaza as Assisted Living Executive Director. Go ahead, Edwin.
I'm Edwin. I'm the Marketing Director. I've been in healthcare for a little while. I've been at the Plaza since May, and I enjoy what I do.
That's great. And Tony, if you could tell our listeners and viewers a little bit about what Trilogy does and how Trilogy works with.
Yeah, definitely. So Trilogy is a Medicare certified home health agency, and we help the community with all different kinds of disciplines, whether it be from physical therapy, occupational therapy, skilled nursing. We have a certified wound care nurse, not a nurse, but nurses, that we offer to facilities, or I should say communities, like Plaza at Hallandale Beach. And how it works is, I'll give you an example. We had a young lady that they called me and said they have a new person that was admitted to your community. And we went and talked to her, and it was perfect because she actually ended up being in the memory care part of your building, and we offer psychiatric care, not care, but psychiatric nurses to be able to come in and care for the nurse in addition to physical therapy, occupational therapy, and that's really how we work. What it is that their team, Vonnie, I got to shout them out, sorry, because they're the ones, they're out there, they're the ones that help communicate with me. Vonnie, Ashley, and Denise, they're the nurses and med techs that work day in and day out with the residents, and they call and say, hey, listen, we think that this resident might need your care based on the information that I bring to them. So weekly I go in, I talk to Ashley, I tell her, hey, look, we do this and we do that. We do psychiatric care. She's like, oh, great. We do pelvic, floor therapy. And so, that's really how it works is, I go in and tell them all the different services that we offer, and they connect the dots with their residents and see how it can best fit. I guess that was a really long way of answering a really short question.
Oh, I think it's fantastic. It's perfect. Claudia, if you could tell us a little bit more about your company, about Plaza of Hallandale.
So we are an assisted living with an ECC license. So that's an extended congregated care license. It's a total of 120 beds, and we include the memory care unit in there. What the ECC does and what people don't realize is that we're unique in that aspect because it allows us to keep our residents in-house. So, for example, a lot of our patients in the memory care, as they decline, some of the families would like for their loved ones to stay with us. And we're able to meet those needs by having that license that allows us to either, if they go on a therapeutic diet, we can manage that. If they need a PEG tube, because sometimes they can't swallow, other things arise, that also happens. We can actually send them to the hospital, they get the PEG tube, and they come back to the community with that skill service.
What's a PEG tube?
It's a tube that goes in your stomach, and that's where you do the feeding.
Okay.
Nutritions, yes.
And that's one of the things that we specialize in as well. So we're able to do that. It's one of the few things that we offer that a lot of agencies don't offer. So again, that's one of the reasons why they would partner with us, to work with some of their residents.
And you work so well together, for sure. Okay. So please share with our listeners when you would place a loved one in each level of care.
Okay, how we determine that.
Yes.
So when Edwin makes that first connection with the family, he's the first person to go out and meet the resident. I come out and I do an assessment. So based on that assessment, and we ask questions such as, are they able to bathe independently? What care do they need? So toileting, incontinent care, meals, any therapeutic diet. There's so many, diabetic. What else do we ask?
Grooming. Just a bunch of things. ADLs, just figuring out kind of what our responsibility is to the specific resident. And based off of that, we determine what their level of care is.
And so you're in assisted living and also memory care. And are there any other levels of service or levels of care, that you provide? And what determines, when they moved from one level to the next?
As they assess, the nurse would do an assessment. So I do the initial assessment. We come in, we meet them, let's say at a level 1. So as the resident declines, it depends on their health. Everybody declines differently. That's when we reassess, and then that's when the level of care increases.
Okay, so everybody's involved.
Yes.
The nurses. That's okay. Great. So can you walk our listeners through the process of determining when they should move into your community versus a skilled facility?
Okay, so when they should move into our community, it's very hard to determine that. Because everybody's different, and I think every family member, sometimes you have people that they're ready, but they don't want to. That's important. They need to accept that they're ready. But anybody that has frequent falls at home, anybody that is, for the caregiver especially, they reach a point where they're tired when they feel that, unfortunately for them, it does become a burden, and they don't want to do it anymore. That's the time that they need to start reaching out for help. And it's a very hard step to do, but that's why we're there.
And we see that. I mean, we were actually talking about this earlier today, about family members not really understanding that, hey, now it's time to move to the next phase. A lot of times we'll care for that pre-resident, the patient, at home. Right. Beforehand. And like you said, they might have multiple falls going in and out of the hospital. And that's one of the things that for us it's important to really break that cycle of them going in and out of the hospital so many times. And if we're offering the care and we're caring for them in the home, it might now be the time for them to say, hey, you know what, I'm ready to move into the next phase. And that's when, you guys come in and actually, make that their home, because I see the different residents that are there, and this is their home. I've been going there and working with Plaza for years now, almost 4 years, going on 4 years. In July, it'll be 4 years. And I see the same folks, and this is their home, and this is their family that they have now gone from this place to now making this their family and home.
And it's okay. And it's okay to want to place someone at an assisted living. There's nothing wrong with that. And I know a lot of the time guilt comes in with that, but it's okay to do it. That's why we're here. That's why we're experts. That's why we have caregivers to help relieve some of that, so you can become family again, where you can come in, you can visit at any time, you can enjoy a meal at the community at any time with your loved one. You can take your loved one respite, so you could pull your loved one out of the community for the holidays, for birthdays, for any time you want. But we're there 24 hours to take care of them.
All right, that's fantastic. So let's switch this up a little bit and tell us a little bit about the fun programs you offer. Edwin, you want to take that?
Yeah, so we have quite a few programs, and we have an activities director that facilitates the different programs, whether it's outings, whether it's people coming in to perform or entertainment. We hired someone new that's going to start a gardening program just to kind of keep them active. So there's a bunch of different things that as you age, you can still do to kind of stay entertained and engaged.
And they also definitely, like I said, I've been going for years, so I know a lot of the different things that you do. But, birthdays are a big deal, like celebrating everybody's birthday monthly, any of the, holidays that we call, St. Patrick's Day, Valentine's Day, anything like that. There's always something going on related to any of the holidays. And they're all in. They're all ready to participate. Mardi Gras, everybody's got Mardi Gras beads on. I saw for Halloween, there were tons of, not tons, but there are a few of the those beautiful hand-painted pumpkins. And the one thing, I'm sorry, I don't mean to do it, but I love this. The young Hasidic women that come in and sing.
Oh, yes.
Oh my God.
Oh, they're amazing.
Oh my God. It's just beautiful. They come in and the people are just sitting there, and and they come and volunteer. These kids, they're like teenage kids. They come in and they sing, and so there's always something going on there. Definitely.
All right, that's great. Well, on that note, we're going to take a short commercial break. We'll be right back. You're listening to your Hometown Health Show. We'll be right back.
Trilogy was established in 2016 by industry experts with over 30 years in home health care operations spanning 30-plus counties throughout the state of Florida. With offices in Jacksonville, Port St. Lucie, West Palm Beach, we strive to provide the most optimal care to our patients in a fun, forward-thinking environment. Our focus is on personal relationships, whether with an employee, a patient, or an outside community. Because we know that when people enjoy what they do, it becomes why they do it. Call Trilogy today at 954-689-6660 and ask for more information. In addition to offering the standard mix of services, SN, PT, OT, speech, MSW, and HHA, we also take great pride in being on the cutting edge and offering care and education to our licensed clinicians in other areas most agencies likely don't offer. Emotional and behavioral health with our psych nursing, biofeedback for bladder incontinence and pelvic pain, chemotherapy, IV hydration, antibiotic and respiratory therapy. Call today at 954-689-6660. Trilogy Home Care. You have been listening to the Trilogy Home Health Show, and if you wish to be a guest on our show, please call us at 561-670-9213 and let us share your knowledge and information with our listeners. Trilogy Home Health Care Show enjoys serving the community and bringing doctors and facilities of interest to help educate and inform the community. Please call us at 561-670-9213 and let us put you on the airwaves with the Trilogy Home Health Show.
Welcome again. You're listening to your Hometown Health Show, and I'm Yolanda, your host of the show. We have as our special guests Claudia Porta and Edwin Charles from Plaza of Hallandale Beach. I don't know why I have such a hard time saying Citadel is so much easier. Plaza of Hallandale Beach. And we also have Tony from
Trilogy. I'm here.
And we were talking about all the fun stuff that Plaza of Hallandale Beach offers. So now we're going to get back to the nitty gritty. Who pays for the services offered by the Plaza?
So the families, a lot of time Medicaid helps. Pensions also help. If you invest in a long-term care plan early enough, that'll help pay for treatment. Medicare as well. Not specifically for a room, but for
Services and care.
Provided there, correct.
Okay. Tell me what sets the Plaza apart from other communities?
Well, as she mentioned earlier, we have an ECC license.
Right.
Most of the ALFs have a standard license. We have an ECC license, meaning we're required to have a nurse 24 hours. And with that nurse, we can provide specific care that other ALFs aren't able to.
Okay. And so if you could please give an example of how, for our listeners and viewers, of how you work with Trilogy. If you could provide, I don't know, a scenario of a patient that you've had to use Trilogy for.
Yeah, we just did actually. We had an admission recently. Someone moved in. They needed to continue their physical therapy and occupational therapy. So we just make sure that the physician wrote the orders, and we just called Tony, and I told him to please make sure to come through and make the magic happen.
And what happens is, too, like I said, we work closely with Ashley, who is her director of nursing, and we talk about, the patient and, what their diagnosis is. And so based on the diagnosis, there might be some things that might not be on the order that I would suggest to her. Like if it's a cardiac patient, we do something called, it's called, the technical term, it's the generic term is called a Zoe, but it's oh my God!
It's all right. Spit it out.
I lost it. It left my brain.
We'll come back
But it's basically a machine that detects whether someone's fluid is too high or too low. So 2 weeks out beforehand, we can tell if someone is dehydrated, so that they're not able to have to go to the hospital. It's a bioimpedance machine. That's what it's called.
Oh,
There you go.
I was like, I'm going to get that. But that's, that's a perfect example of how we work together, is making sure that the information is shared and that they're getting the proper care. And so the order may just come and say physical therapy, but I'll talk to Ashley and say, hey, listen, I've looked at the chart. This patient has this type of diagnosis, and suggest other things that are going on. One of the things we were actually talking about, before we were talking about incontinence, we do pelvic floor therapy. That's really something that's important for, ALFs, because it cuts down on their costs for, pads, that sort of thing. And it's actually known that if someone gets up 2 or 3 times in a night, I know I'm getting off on a tangent, but I just wanted to make sure that we talked about this, because it's important for, these guys and viewers to know that people, if they get up 2 or 3 times in the middle of the night, they're twice as likely to fall. And a lot of times what happens is they don't associate incontinence with falling. And, I'll just share, like I was talking to you before, I was at my mom's in New York this past weekend. She got up like 4 times to go to the bathroom in the middle of the night, and she's wandering through, and I'm like, oh my God, like that's exactly what happens. They get up and they have to go really bad, and so they rush and they fall. Yeah. So the pelvic floor therapy, like again, that would be something I would suggest to Ashley and say, hey, listen, they need that. It'll cut down on your falls, if it's someone that's a candidate for it. And that's how we work. We work as a team. We share information to make sure they get the best care. That answer your question?
Definitely.
All right, cool.
For sure.
That make up for the brain fart?
I think our listeners and viewers have been well informed. So how can they get a hold of you?
They can reach me, my cell phone number. They can come to the community. They can reach Edwin.
They can call our office. It's 954-961-8111.
And I have here, your website is citadelcarecenters.com. You meant we were talking earlier. Plaza of Hallandale Beach is part of Citadel. Okay,
That's correct. That's our corporate office. So that's our main umbrella, but we're under.
Okay.
So one of the other things too that we partner in, and we actually set up something to do a talk with their community on fall prevention. But you guys are actually setting something up too for your community that's starting in March.
Yes, that's correct. So we are opening it to the public. We are starting a family support group for all the families in our community and outside that have loved ones that are struggling with Alzheimer's and dementia. It's open. We'll go ahead and we'll answer questions. We'll go ahead and we'll talk about the disease process and what they can expect. And they'll get to meet other people that are going through similar situations. So it's a good thing. It's going to be the second Monday of every month starting in March. And it's from 4 p.m. to 5 p.m. And it's actually hosted, we're co-hosting it with their council.
That's fantastic. Second
that's
Monday of every month starting in March.
Yes.
And what time was it again?
It starts at 4 p.m. all the way to 5 p.m.
That's wonderful. A family support group for that. That is so necessary.
Yes.
And is there any other special events that you have coming up that you want the public to know?
No other special event. We are hosting lunch for Fala.
Okay.
So we will be there. So that's the other thing. And that is the third Thursday of each month.
And that's
At Florida Medical Center.
And that's a
Yes.
Florida Assisted Living Association or something like that.
Yeah.
Okay.
Yeah.
Okay. Thank you.
Fala,
Gotcha.
Florida.
Yeah. And it's a good crew. So it's a great thing. I didn't know you guys were hosting. That's
Very
awesome.
informative.
I will be there.
Good.
Oh,
Fala. Okay. I gotta look that one up. All right. So again, if you want to get a hold of Plaza of Hallandale and you want to speak to Claudia or Edwin or anyone else there, their phone number is 954-961-8111. Or you can go to their website at citadelcarecenters.com. And you guys are located in Pembroke Park. Is that right?
yes.
Correct. Pretty close to
Okay.
Hallandale.
Yes, very close to Hallandale. Okay, all right. And is there anything else you want to leave our listeners or viewers with? Any tips as far as taking care of their elderly?
You first.
Tips? Well, there's a lot of myths about dementia and Alzheimer's, and you come to our meeting, we can dispel those and provide you with some real facts.
Oh, I like that.
That's
I
great.
like that. I think asking for help. There's nothing wrong with asking for help. I think a lot of times people just want to do it themselves. You want to take care of your families. I can relate. But you know what? Leave it to the experts. That's why we're here. We do what we do very well. And so you call us, we'll take care of your family.
Come by for a tour.
Yeah, I mean, I totally understand. My mother takes care of my grandmother. She's a caregiver, and I don't think they're ever going to put her in an assisted living facility. But that's how Latinos are. It's very tough for us to,
And that's our job, is to educate
Yeah,
the community, to
correct.
let them know that it's okay.
Yeah.
That there's another option.
Correct.
Everybody's entitled to what they want to do, but there are options. That's all.
Definitely. Well, again, it's been a pleasure to have you both here. Claudia Porta from Plaza of Hallandale Beach, Citadel Care Centers, and Edwin Charles, Sales and Marketing Director from Citadel Care Centers, also Plaza Hallandale Beach. Thank you so very much.
Thank you.
And thanks, guys, for
Thank you for
coming.
having us.
Thank you.
Thank you, Tony.
My pleasure. My pleasure.
Thank you to Trilogy
Yeah, thanks, Trilogy.
for sponsoring. And again, I'm Yolanda Santana. You've been listening to your Hometown Health Show. Thank you so much. You guys have a wonderful evening.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com. The opinions expressed on the preceding sponsored program were strictly those of its host, guests, and